The following is paid programming.
It's time to talk taxes.
New friends, new opportunities, new partners. EG Tax.
It's Ask the Tax Lady with Esther Gulius and EG Tax on News Radio 930 WBEN. To reach Esther now, call 803-0930. Toll free at 1-800-616-9236. And cell calls are free at star 930. And now, live from the WBEN studios, it's Esther Gulius.
Well, hello, everybody. Finally, the 2019 tax season is in the can. We really, this was really a hard thing to go. When you normally are done April the 15th and you went to July the 15th, that was tough. But we did it, and we are so thankful. I'm thankful for my staff who just they just rose to the occasion. And we're thankful to you, the people that use EG Tax, where we really try to do a good job. And it was another successful year, but I will tell you, it was a long way to do. And I'm joined in studio today with Chris Fabian. Hey, Chris, that was tough, wasn't it?
Oh, my God. I've never seen a close like that. And this was a second close.
That's right, because our first close was many people I talked to say, no, April 15th, that was it for me. I'm not doing. But then we had this second close, and it looked like some of the stories that I heard, people just said, gee, I was busy doing barbecues in the backyard. I was so happy I could be with my family again from COVID. I forgot about it.
Yeah. And, before the show, Tim and I were talking, we're like, what would it have been like if they did extend it to September 15th and all these procrastinating? It would have been even, geez, I don't even want to.
It was just unbelievable. And we also have Tiffany Fabian is not here today. She took the Saturday off because we have Tim Elias in here. Hey, Tim, how are you?
Hello, Esther. How you doing?
Good. And Tim, of course, is our president of EG Health Connect, and he's going to talk to you. So if you don't have health insurance or you're paying COBRA, pay attention, because Tim's going to save you a lot of money, because we're moving from our tax show, which we always do on Saturday, and we always obviously talk about taxes. We broaden it out to other areas that are very important to people. And so today we're going to finish up our series on taxes and move into health care, which so many people know how much you pay for health care, or you don't have any health care. And I think you're going to find out that Tim has some really great suggestions for you. So 8030930, 8030930, star 930 on a cell phone. You can text us at 716-8030930. We would certainly love to hear if you were one of those last-minute people. We tried to social distance. I mean, our lobbies, like our receptionists, are like in a goldfish bowl, but it was tough.
Oh, it was just insane. I mean, we had people standing outside the building. The line was outside the building, and it ended on Tuesday night. Yep. And Wednesday was just yeah. But it was this Monday, Tuesday, and Wednesday this week was just crazy with the amount of people that came in through our doors.
But let's say you haven't filed yet, and I think there's probably a lot of people that just said, I just don't feel like doing it. The important thing is that the closer to the 15th of July that you file, the lower your penalty is going to be if you owe money. A lot of times you see people that say, well, I don't have the money to pay the liability, therefore I won't file. But that's bad thinking, right?
Oh, definitely. It's
because the failure to file penalty is 25%.
Yeah, 5% a month. Up to 25%. So you owe $2,000, you just added $500 to your tax bill.
Right, but if let's say you file Monday and you owe the $2,000 and you don't have the money to pay it, by virtue of filing, you've saved, like Chris was saying, that $500 penalty. The failure to pay penalty is $50. So you save $500 on the one hand. It is true they're going, because you don't have the money to pay it, there's going to be a $50 penalty for failure to pay, but the failure to pay penalty is littler, a lot littler, than the failure to file penalty. And of course, we now go to our regular off-season hours, which is 9 to 5, Monday through Friday. And of course, we make special appointments if you need evening or Saturday appointments, right?
Right. We're there for you. Our website is always open with Ask the Tax Lady. I know Esther always answers those questions right away.
Right.
So you could always go to our website at egtax.com, click Ask the Tax Lady, ask your questions, and you'll get an answer probably within 5 minutes.
Right. Now, what if you don't have the money to pay? What if you're somebody that doesn't have the money to pay? What are some of the options that people have?
Well, the first one is a payment plan. The government will always do a payment plan with you. They like it. I think now it might even be up to it's
Do they
6
check your
years. It
credit
used
first?
no,
Yep.
no credit check. 6 years they give you to pay, but you got to remember there's always interest and penalties that they're going to assess to it.
Right.
So
But
it's
of course, the big penalty is failure to file.
Correct.
If you file your return or you haven't filed and you get it filed right away, that penalty will be much smaller then, and the penalty and interest for not paying are smaller penalties than failure to file.
right.
There's also something called offers and compromise, right?
Right. Go ahead, Tim.
Yep, offer and compromise where, Tiffany does a great job with those. She kind of spearheads that for us, and she can work with you and work with the IRS in New York State and say, okay, here's what their tax liability is. There's some things that they bring in with, what are their budgets at home? How much can they afford to pay? And quite possibly settle the tax liability and get into an installment agreement for much less than what you may originally owe.
Or just a lump sum for pennies on the dollar.
Exactly.
Because they want you to feel empowered to move forward and make money in the future, as opposed to somebody that says, I'm not going to make any money, it costs me too much in taxes. So
Yep.
we have the offer and compromise with the payment program.
And there's even some people who go on what's called an uncollectible status, where they're for 10 years, they just keep checking. The IRS will check your finances, and if you can't pay after 10 years, that debt just goes away.
Goes away.
But, the important thing with both of those is that you have to be consistently filing. You got to keep filing those returns.
Right, absolutely. Now, what if you found out this last week, that you owed money that you didn't think you did? What should you do now? Assuming you could pay it, so there should be a kind of a call to action.
Yep, it was interesting, like you said, with the extended season, to kind of sit down with people and say, okay, what do we need to do to address this so that it doesn't happen? And as we looked at each other saying, wow, we're going to be doing this 4 months from now, getting ready to file your return again. But because I'd sit down with clients and say, okay, here, we're doing 2019. They'd kind of look at me, it's the middle of 2020. And you have to start planning, whether it be changing that withholding, or for some clients, it's maybe thinking about getting set up on some estimated payments.
Right. So if you know that you're going to owe in 2020 and you haven't paid in and you're going to owe more than $1,000, the IRS does something called estimated tax payments, where they actually let you prepay your liability because that's how they want it paid. And if you call EG Tax, we'll help you with that.
Yep,
Right.
and odd enough that the first estimated payment wasn't due till July 15th.
Right, but
So-
then there was two of them due.
Yeah, exactly.
Right? Why don't we talk to Mike? Hey, Mike, how are you, sir? I'm Esther Golias.
Good afternoon.
Hi.
I got a letter that I owed the state $600, but I'm currently unemployed. Could you give me an insight on?
Okay, so did the letter would have said why you owed $600? Did you?
Yeah, I made an error in my return, which I fully acknowledge. It wasn't intentional.
Okay.
I have a very basic income.
What would you guys say that Mike should do?
Well, if you can't afford it, I would call them up and go on a payment plan with them. They'll take $50 a month.
Right.
Okay.
And then you'll have it pretty much paid before next year, and you'll be good to go from then on out.
Yeah, as soon as I, get employment, gainful employment when this economy, if it ever gets back going, I worked at a private school, but when this pandemic hit, this whole thing crashed. Our school
Absolutely.
never even had Zoom.
Yeah, but that's the important thing.
So-
It's like anytime you have a creditor, talk to your creditor, and they will work with you.
Thank-
And if you need help, you can call EG Tax. We'll do a three-way for you.
Thank you.
Okay, thanks, Mike. I'm Esther Golias, the tax lady from EG Tax, 8030930, 8030930, star 930 on a cell phone. You can text us at 716-8030930. We're going to take a short break. We're going to be back on the other side with your comments and questions.
We are family.
And to us, you are family. I'm Esther Golias, the tax lady from EG Tax, and I will tell you, tax season may have ended on Wednesday, but we're still in the saddle. If you haven't finished 2019, or you need help with 2020, we're here all the time. It was weird, but we're moving. This whole thing has been weird. I was shopping today, went grocery shopping today with my mask on. And I was thinking how I can't breathe with the mask on, but what are you going to do? This is certainly, like they say, trying times. Really trying times. Before we get to the phones, again, 8030930, 8030930, star 930 on your cell phone. Things that business owners need to know. The PPP it came out as a loan. You need to fill out the application to the to SBA for loan forgiveness.
Right, call.
So if you need help with that, EG Tax will help you, and the time is a ticking.
Right. Yep. I mean, call us.
If your business started off with a $100,000 PPP loan, it can turn into a grant, but you got to fill out the forms.
Correct. Yes.
Right? And then don't forget the employee retention credit. Can be up to $5,000 per employee if you didn't get PPP, and many people didn't get PPP. So if you need help with that, that's a refundable credit right now. And then there's the FICA deferral from half of it till 2021 and the other half 2022. I read an article the other day that said, "Oh my God, how are they going to ever keep track of that?" And don't forget, no RMDs are required, but you might want to take it out anyway. And there's going to be a stimulus credit on the 2020 tax return. So if you didn't get it, you can get it then.
Right. It's not a new stimulus.
Right. But they are talking about a new stimulus. And then the other thing is you can take an emergency withdrawal from your 401k up to $100,000. Don't recommend that you do it, but again, before you go and take your money out of your 401k, talk to us. And if you've lost your job, you can't borrow it. That's for sure. You can take it out, but you can't borrow it. If you can borrow it, that would be the best, right?
Right. Yep.
Okay, why don't we go back to the phones? We'll talk to Gary. Hi, Gary. How can we help you, sir?
Hi, I have an EIP payment card. It was sent to me, and my wife's name is on it also. And they tell me to activate the card. She passed on May the 3rd.
So at the time, but at the time that you did the return, your wife was alive. Is that correct?
At the time I have not done my return for this year. I'm alibied until October.
Okay, but the thing is, Chris, the economic stimulus payment, if you were alive in this year,
when did you get the card?
I'm not sure.
At the end of May?
The end of May.
Yeah, so unfortunately, you're going to have to return $1,200 of that back to the government.
The card was not for $1,200.
It's for $2,400, right?
And it's not for $2,400 because I make more money.
Okay, so half of it, you're going to have, whatever you received, if it was $1,500, you would have to return $750 of it back to the federal government.
Again, if you want to call Gary and talk to us, there's no charge to help you to figure out how much to do and where to mail it to.
Already?
Yeah, so give us a call during the week at 632-7886.
7886. 86.
Yes.
Thank you so much.
You're welcome.
Gary.
Sorry about your
to hear
wife.
About your wife. Okay, and we got Marlene from Lancaster. Hi, Marlene.
Oh, hi. The reason I'm calling is if you don't owe any money on your state tax, do you get a penalty if you don't file on time?
No, the penalty is that you don't have your money. After 3 years, they keep your money.
Yeah.
What a lot of people don't realize is that after the statute goes, if you had a refund, and I know, remember, Chris, we had that one lady that had earned income credits set up the wazoo and she didn't file,
Yep.
and they left like like $30,000 on the table because the statute had run. So the only penalty is that you don't have the use of your money.
And do you own a home?
Yes.
You're going to want to file because the state now controls the STAR program,
There you
not
go.
the local governments.
Oh, okay. Yeah, well, I'll tell you what, it's really for my daughter. She was going to file, and I told her, I said, you don't have to file right away because you don't owe anything.
But you know what happened is,
Okay.
and we saw this, time and time again this last week. People that said, so they're coming in with 17, 18, and 19, and and things become segmented. You have partial stuff. You forget where things are. It all kind of runs together. I think, fulfilling that obligation every year and making it timely is a really smart thing to do.
Yeah.
For what it's worth.
I just didn't want to be responsible for telling her that she wouldn't owe a penalty.
No, she's not going to own
Hey,
a penalty.
I'm-
But I will tell you, how do you know she doesn't have a balance due?
No, she doesn't have a balance due.
Is she your dependent?
No, actually, what happened was she tried to file it on one of those computers,
Uh-huh.
and it didn't want to take her state pension off right.
Okay.
There must have been a button she pushed wrong or something.
Uh-huh.
So then she decided to do it on paper, so she had to go and get the forms from the library.
Okay.
So, but she'll be all right because
All right, good enough. Well, that's good.
Yeah.
All right. Thank you for calling, Marlene. I'm Esther Gullius, the tax lady from EG Tax, 8030930, 8030930, star 930 on a cell phone. 716-8030930 is our text line.
Correct.
Right?
Yep.
Any stories before we move on to health insurance, Chris?
Well,
You
just-
wanna- or Tim?
Like you said, if you don't file, you don't know if you have a refund or a balance due. How many people have come in the last week saying, I knew I was going to owe, I waited, and they ended up having a refund, and they're like, if I would have known, I would have been here sooner. That's the biggest thing I've seen was people who had bigger refunds or less balance dues than they thought.
Absolutely. Well, you know what? One of the things that happens with all this coronavirus and pandemic was a lot of people got furloughed or got laid off, and so then the payment for their health insurance became their responsibility, and for many people they're paying COBRA payments. And so Tim Eliason is the president of EG Health Connect, and he's a kind of a health insurance guru. And for those of you that are paying for COBRA or have no insurance or are paying large insurance premiums through your employer, I think we have some great news for you. And Tim, I just thank you for coming and joining us.
No, that's no
on
problem.
A Saturday.
No, that's no
so
problem.
let's talk about who should look at using the New York State of Health.
Well, there's a vast number of people that should, and I've just what you mentioned. There's a lot of people that were furloughed that were maybe even on the verge of retirement, and they have decided that I'm not going to go back to work. They've offered me a severance or whatever it may be, or they've offered me an early retirement package, and you brought up COBRA. And, they think that, well, hey, I'm going to get this great COBRA insurance and it'll tide me over maybe till I get to 65 and Medicare. But it's not always cost effective, and it can cost them a lot of money, especially if their income is going to be changing from when they're working to what they're going to use for retirement. So the New York State of Health is perfect for them. I have a
Because
lot
the
of
New York State of Health bases it on your income,
yes, it's right off the
whereas COBRA is based upon the employer plan.
yes, basically
Right?
whatever the employer had paid for that individual's health insurance, if the full retail price, I guess would be the best way to say it. And the option is that you can go into the marketplace. You can find that there may be a subsidy or credit to help. I mean, there may be even an opportunity where you get it down to $20 a month. I've met with a lot of families too that one of the things the New York State of Health is great about is the fact that maybe you start to think, as opposed to doing a family COBRA plan, you start spinning the kids off. You look at Child Health Plus if they're under the age of 19. You can save a lot of money then, and then each one of them can get an individual plan from their employer, and there's a lot of options that I don't think people realize.
So if you're somebody that had been furloughed, lost your job, are now on unemployment, you've been picking up your own health insurance, and your income's going to drop substantially this year, the New York State of Health may be your best answer to your health insurance because they base it on your income that you're going to get as opposed to what the company had negotiated. So if you're paying $1,200, $1,300 a month, New York State of Health may be the best thing for you. Tim, so people can pay zero premiums, right? I know we only got a minute for news.
Yeah,
Give us a primer here before.
Yeah,
we go for
Medicaid.
news.
If an individual is below now with the level it's at is 17,000. If individual is below 25,000, that's $20 a month. So there's a lot of options.
And this is income that they earn, not their assets.
Exactly.
They can have $1 million, right?
Exactly.
But
Exactly.
their income is under that $17,000 figure, and they get Medicaid.
That's right.
Right?
Yep.
All right, I'm Esther Golias, the tax lady from EG Tax. 8030930, 8030930, star 930 on the cell phone. Our text number 716-8030930. We'll see you on the other side.
We are family.
Hey, to us, your family. I'm Esther Golias, the tax lady. It may have ended on Wednesday, but we're in the saddle here for the rest of 2019 and the beginning of 2020 right now. We have our special guest in studio, Tim Eliason. He's our president of EG Health Connect. He's like really, really smart with health insurance. And I'm going to tell you, health insurance, just don't kind of turn off your head. Many times people say, oh, no, I don't have health insurance because I can't afford it. And I say, you got to go talk to Tim because, you may get it for free. It's hard to believe.
Yeah, I mean, I just want to say, I know we had a couple people this week that didn't want free or the essential plan because they're like, ew, no, that's not good health insurance. Why would I want that?
I would love that kind of health insurance.
It's
because
better
really
than my
good
health insurance.
Yep.
I'm telling you, because the health insurance that the rest of us pay for is not as good as Medicaid. Hey, let's go to the phone zone and talk to Marianne, who's been holding and holding. Hi, Marianne. How can we help you?
Hi, Esther. I have a question. I had my taxes e-filed, and I got a letter back from New York State stating that the 1099Rs didn't match up with what they had. So my tax preparer resent those, so I haven't gotten my refund back from New York State yet. In the meantime, I had to amend my taxes. So the original tax say I was going to get a refund of $2,000. With the amended taxes, it would only be $1,500. So when I sent my amended tax back, the bottom of the form said that I owed $500.
Right.
Well, being that I didn't get the original refund from New York State, did I have to send the state the $500 even though they're
going to process the one over the other. So they should process your refund first and send you your $2,000, and then you would have owed the $500. So that's how it's done in steps. So that you proved that the 1099-R was correct, then they should process that and get you the $2,000, and then when they start processing your amended return, they will be looking for that $500.
Okay, I didn't send them that $500.
Then believe me, they will bill you.
Oh, okay. Is there
Okay.
a place I can send it to before they start?
Well, I mean, I think there's probably a phone number on that bill that they sent you. It wouldn't hurt to give them a call and explain everything and see if you can't just fax it over to them so they can kind of, with one auditor, put the two pieces together.
All right.
I mean, that would not be a bad idea.
And you can also go to tax.ny.gov. They have a little portal there that you can do make a payment, and there's a document number on the top right corner of that notice where you can make sure that you say, okay, I acknowledge this or whatever, and make that payment based on your return too.
Right. Okay.
So can you just repeat that last part about going into the portal for New York State?
Yep, just there's at tax.ny.gov is the website, and up at the top across their header bar, there's a thing that says individuals, and when you click on that, there's a place to make payments, and they give you various options of what you want to do. So if you want to make a payment that way to get something on account, like you said, you have that $500 to say, okay, I'm making a payment for the 2019 tax return, so they know and they can make that adjustment.
Okay.
Okay.
Thank you very much.
All right, thanks, Marianne. And let's go to Kay. Hi, Kay. How can we help you, ma'am?
Hi. There's two things I want to mention. If you do go on Medicaid, there's a lot of specialists that will not take it. Am I right?
Well, again, it sometimes it's a play on words. The traditional, original Medicaid, that is correct. What the Marketplace offers is what they call managed care, that is administered by the Blue Cross, Independent Health, Univeras, Fidelis of the world, and that is something the insurance they will take. But if you call up to a specialist and you say, hey, I'm going on Medicaid, there is just plain old-fashioned Medicaid, they won't take that. But if it's being administered through the Marketplace by an insurance company, they call it managed care, and we find most of the time that, if not all, that the specialist will take that.
Oh, okay. And what is that thing? If you don't pay your taxes for 10 years, it's wiped off?
That's correct.
If you
you're
have
unable, go on, Chris.
If you're unable to pay, where they say they'll call you every year and say, tell me what your income is. Tell me what's in your bank, now let's talk about your liabilities. How much do you pay for this? How much do you pay for that? And if they see you can't afford to pay the money, they will say you're uncollectible. But if you have $30,000 in the bank and you're not paying them, they're going to say, no, you can pay us. You need to pay us.
But if you're truly uncollectible, and for 10 years you're in an uncollectible status, the liability drops off on at the end of the 10th year.
Okay, thank you.
All right. I'm Esther Gilius, the tax lady from EG Tax, 8030930, 8030930, star 930 on a cell phone. Our text number is 716-8030930. We have special guest today, Tim Eliason. He is our healthcare guru, and I'm going to tell you, if you haven't gotten health insurance because you maybe lost your job, you thought it was too expensive, I'm so glad you're listening, because Tim has helped so many people. So let's talk about that, Tim. Medicaid for people that don't have any assets is one thing, but Medicaid for people that have assets but not much income through New York State of Health is another thing. Kind of explain the difference.
Yep, and it's the channel that you have to go through too, because if you're an individual that's required to go through the county social services, they are going to ask about assets, and that's typically you would see that for somebody that maybe has other social assistance. But if you're an individual that has lower income, and it's again what shows up, that modified adjusted gross income on your tax return, then you can go through the Marketplace and there's not a single question about assets. It's all about what it shows up on paper, both historically on your tax return and projections. So when I'm meeting with somebody, I'm saying, okay, let's try to figure out what your 2020 tax return is going to look like. Where's your income going to be? Because that's what we will base on choosing the insurance plan that you qualify for.
And so the thing is, you could have $500,000 in a bank and pay a paid-for house, you lost your job and maybe you're living on unemployment of $15,000, that would be somebody that would qualify for the New York State of Health managed care Medicaid.
Exactly.
It would cost them nothing.
Exactly. And, taking that a
But
step
if
farther.
they don't apply, do they get it?
No.
Right. I mean, and that's the thing. Sometimes people kind of turn a deaf ear and they go, "Oh, this is too good to be true." But in this case, it is true.
Yeah, exactly. And, the thing about it, too, is that it does become a numbers game. There's ways, and they say, oh, well, I'm making $18,000. I guess I won't qualify. Well,
IRA.
Open that IRA. Would you rather send the money to yourself to pay for your health insurance, or would you rather just send it out the door to the insurance company in a premium and never be seen again? If you
Now,
pay yourself.
How long does it take to get? So let's say somebody does qualify for the managed care for Medicaid. How long does it take to get on the program?
Well, the thing about if you qualify for managed care is you kind of end up with two insurances. So if I sat with somebody right now and they qualified for managed care through the marketplace, the Medicaid portion backdates to the first of the month of that we're in. So right now, if I sat with somebody, the Medicaid would go back to July 1st, and then the managed care through the insurance company would start the first of the next month.
Doesn't the bills, can't they even go back 90 days prior even to pay those bills too?
Exactly. If we can show that their income prior to the enrollment for 90 days, say that they, had to go to the emergency room, didn't have insurance, and they said, well, I better get insurance, then we can submit for reimbursement for those bills back 90 days.
If they paid them.
Yes. Yep. So they can get assistance with that. So there's a lot of
that's
options.
And that would be zero premiums, right?
Well, as zero premiums, and there's two levels of that. Sometimes people forget when we go up to the next level where we go that essential plan where everybody thinks, well, it's $20. There's actually a portion of that that's kind of in between the managed care and the essential where you're still at zero premium. So even though you might be above $17,000, if you're still below $19,000, you still have a zero premium, zero deductible, no co-pays for all your medical care.
Wow, that's remarkable.
And then,
Tim, how many times do you see people who just they thought that this was too good to be true and they just never thought that they could get health insurance like this?
Well, and quite often. And I, like I said earlier, and one of the callers said, they said, well, nobody takes it because it's this or that. We have the database. We can look up the healthcare providers and the doctors, and they all take it, and they just sometimes have a misconception about it. And like I said too, the other thing I can't stress enough is that for families, we're under tough times right now. We want to take care of everybody, and Child Health Plus exists in New York, and it is an opportunity, and it is not necessarily just a low income type of situation. I was working with somebody the other day that somebody can qualify for Child Health Plus and get insurance for their child for $60 a month, and their income could be $10,000. And at $60 a month, they have no deductible, no copay, medical, dental, and vision for their child under the age of 19.
You mean their income per month is $10,000?
Yes.
So they make $120,000 a year.
Yep, there was a family of
They
five.
would qualify for Child Health Plus.
Yep, it was a family of five, and the reason we were doing it is because one of the two parents was losing their position because of COVID, and they were looking to figure out, and they were thinking about paying for COBRA, and it was going to be a family plan through the employer that was going to be $1,800 a month. Well, we split them up, kind of had the parents do that on their own thing, dropped their insurance down to about $400 a month. We put the kids on at $60, and that's $180 maximum. Even if they had 4 kids, it would still stop at paying for 3 kids. The 4th one's free.
Boy, I'll tell you. So especially many people are just now as the emergency, the pandemic, unemployment insurance is coming to an end. A lot of employers are coming back. Employees are looking to go back. They're finding that the position might have been eliminated, and you want health insurance. EG Health Connect is there. What do you charge people to do this, Tim?
We don't charge anything to do it.
That's absolutely a no-charge situation. So you can make your appointment with Tim by calling our corporate headquarters at 632-7886 and just ask for Tim Eliason. and he's there to help you. Let's talk to Frank, who just called before we go to break. Hi, Frank. How can we help you?
Hello, Esther. I'm actually a new client of yours. I got a question and a comment.
Yeah.
One, I'm getting divorced, and I did not get the stimulus this year, and I understand if I file next year, I'll get it in next year's taxes.
Right.
Okay. Now, I do have 2 children, and one of them is in, I guess, my custody. So I would get it for myself and the child.
How old is the child?
16.
When do they turn 17?
He turned 17 in August, next month.
Yeah, so unfortunately, if we're waiting to file your 2020 return, he falls in that cliff area. Hate to say it like that, but between 17 and 23, there is no stimulus.
Is that website still open, Chris, so they can apply right now and get the $500 for his child and the $1,200 for him?
It seems to be working. It seems to be working.
Because there is a portal that you can go to at irs.gov. If you haven't gotten the stimulus, I don't know. I mean, obviously, there's less and less people that are getting it now because so many people are. So before waiting for 2020, I'd go on that portal and see if you can't.
Was yours in your when you filed joint? Was your income over 200,000?
No.
Was it over 150?
No.
Then, and you guys filed joint for 2019?
Correct.
Then you should still be eligible for the stimulus. If you just filed it, it has to get into their system.
That's right.
So there still could be the $2,400 stimulus for you and your wife, and then possibly the other money for
the kids.
The $500 for the kids.
And make sure when you go onto that portal, do the Get My Payment. Do not do the other portal. There's one that looks like you file kind of a pseudo tax return. What we've been finding with people that have tried to use that avenue is that it creates a rejection with their electronic return because it shows they already filed. So make sure you use the Get My Payment button.
So I guess what I'm saying is, even though the stimulus credit is going to be on the 2020 return, if you can get it on 2019, it would be much cleaner. So I would try, like they were saying, go to the irs.gov and see if you can't get it. And if you just filed your 2019, it could just be coming out in the wash in the next couple months because they will issue it based upon what you just filed. So hopefully you'll get it before 2020.
I'll ask my accountant. That's you. So
yeah, I mean that's what I would do.
Yeah, give us a call during the week and we can help take a look to see.
Yeah, and they'll go on the website for you, Frank.
And Esther, I got to plug you guys. I've gone through. I own a business, and I've gone through 2 accountants in 4 years for my business. You guys, by far, are the quickest, the easiest to work with, and I hate to use the word cheap. I'll say inexpensive. Compared to my other accountants, you guys are very inexpensive to use.
Well, thank you. That's what we try to do.
We'll say financially responsible.
Thank you, Frank. I appreciate the good word. I'm Esther Golias, the tax lady from EG Tax, 8030930, 8030930, star 930 on your cell phone. We're going to take a short break and be back with your questions, comments, and more health news on the other side. Hey, everybody. To us, you are family. And we try real hard to do a good job. We certainly want to help you. We help you with your taxes. We help you with budgeting. If you're, as you age and you want to look at estate planning, we want to help you with that. We kind of are your one-stop shop for your finances. Now, we don't sell stock, but we certainly will help you to read your financial statements. So anything that has to do with your estate taxes, federal taxes, New York state taxes, health insurance, EG Tax is there to help. And today we have Tim Eliason here in studio. Tim, people that, when I talk to people, they'll say, I have health insurance through my employer and it's killing me. Just because you have health insurance through your employer, you don't have to stay with that, do you? No. I mean, you have the option, by the Affordable Care Act that was put in place. If that deduction that comes off your payroll is greater than 9.5% of your gross income, and what that gross is
even though you might have family insurance, it's based on you as an individual and what you would pay for a single plan from your employer. If it's greater than that, then you have the option of going into the marketplace.
And many times the marketplace is better coverage for less money.
Exactly. And then, the other option too is, sometimes, they look at the health insurance and they think, well, I don't want that high deductible plan. That's kind of scary. Yeah, it's very affordable. I can afford to pay that premium and that seems reasonable, but I have this high deductible. Well, the thing about that too is you really have to weigh that too as far as financial planning. Because if you have that high deductible, you are going to be eligible for a health savings account. And if you have, all you do is go once a year to the doctor for your annual wellness visit, you have no other medical needs, maybe that high deductible, and then you can use that money and start putting that pre-tax dollars into that HSA and just start loading up. And
so like the HSA kind of works like an IRA.
Exactly.
So here, when you have a high deductible plan, they let you put like $3,000-$4,000 into this like IRA that you're growing for your health insurance. So to pay for your high deductibles, you get to take this tax deductible money and use it to pay for health insurance and health needs. And if you don't even need it, it just keeps growing and turns into a pension plan ultimately.
Exactly. And I've met with people and we've talked about it too, where they're thinking about retirement. It's a couple years off. Okay, let's max out that $19,000 or whatever it may be into that IRA. Let's max out that $3,500 or $4,000 into that HSA. And then they've lowered their tax burden. They've created all these tax-free dollars, and then by the time they get ready to retire, if they're not to 65, they've accumulated $25,000 or $30,000 of tax-free money to pay for different things for insurance that when it comes to retirement. So they have this little nest egg both in their retirement and for their health care.
Yeah, I guess the thing that more than anything, and I think Chris you'd agree with me, is when you don't know and you don't do anything about it because you don't know, then this benefit can just like a ship pass you by.
Right.
And that's why it's always good. If you hear something like this and you think, gosh, maybe I should ask a question, you should ask a question, because I'm going to tell you, it can save you a lot of money.
Yep.
Right?
Yep. Just like put money in an IRA or your 401. How many people do we see that don't put money in their 401k? I don't like the market, but you're giving away free money because your company matches the first 3% or 2% or something.
One of my clients who I love, they have very, very high insurance. They're now retired, and their insurance, they spend about $14,000 a year on health insurance because they're afraid of moving to another insurance provider because they have pre-existing conditions because they're older. They're like 75 now. But those pre-existing conditions are covered, correct?
Yes. Yeah, I mean, that was a big thing in the Affordable Care Act, and I don't think even if they overhaul it, that's anything they can ever get rid of. And there's, no pre-existing. They're not going to exclude you from any type of coverage any longer with pre-existing conditions.
All right, Chris, why don't we go to our text, and then we'll go to Richard.
Yeah, it's a very simple one. For the stimulus check, I keep getting conflicting answers. My husband and I filed together in 2018. He passed away in 2019. I got the stimulus check for him. I have it in the bank. Should I send it back?
Yes.
Definitely.
Yes.
Yep.
Yes.
Yeah, we don't know,
And again, if you need help where to send it, give us a call. It's on our website, though, right, Tim?
Mm-hmm. Yep, there's information. There's a little bar that says stimulus information.
And let's go to Richard quickly as we're running out of time. Hey, Richard.
Hi, how are you?
Good.
Esther, I made out my income taxes and sent them in at the end of March this year.
Uh-huh.
And I am expecting a refund, but I haven't received that yet.
Was it a paper return?
Yes, it was.
So they just now got back to work this week. So they'll start processing those things in July and August. So I'm assuming maybe September you'll get it.
Yeah, I had a client this week that came in. He was ready for us to e-file. I said, let me check. And it finally said on the IRS's website, we have your return. It is being processed.
Right, and so Richard, go online and see what stage of processing it's in. If you don't have, if they say that they haven't processed it yet, you might want to come in and we'll file it electronically, and you'll have the money in 10 days.
Okay.
Okay?
Thank you very much.
Hey, thanks for calling.
Hey,
All right,
Esther,
so- yes,
Chris
sir.
and I were talking during the break, too. One thing about that earlier caller was talking about the dependent and their stimulus.
Yeah.
One of the things that we've been discovering and talking, and I know I discovered it from my daughter, is that through the CARES Act, a lot of the universities had money given to them to help them with different situations. And what they've turned around and done with it is for those kids that are in college that are kind of in that no man's land, they were not eligible for the stimulus through their parents' tax return. They have turned around and they funneled that money down to the kids in, $500, $600, $700. And the kids were just getting emails from the school that said, hey, tell us what you had, the employment, and then they send them the stimulus through the colleges.
Okay, well, that's interesting.
Yep.
Okay, hey, so, all right, so getting back to New York State of Health, Tim, and
Mhm.
everything that you do, where can people see you? How do they make an appointment? Should they call? Should they make an appointment? Should they stop in? What's the procedure?
Just make a call to the office. I'm there pretty much every day. I do some appointments on Saturdays every once in a while, and I do a lot of evenings for folks so that I can accommodate them with them working and things like that. And like I said, use me as a sounding board. A lot of times I'll sit down with people and then they just want me to decipher the Greek that's handed to them in the form of their benefits and saying, what does this all mean? And, kind of break it down for them and see what the options are. And, I give them avenues. We look up their prescriptions and the formularies, what's covered. We'll look at different things and say, hey, have you thought about pursuing, this option for your prescriptions? Or let's, look at the other 3 plans that they're offering from your employer. Again, like I said, I sit down with families and say, what's the option, if we do
Right,
the kids.
And if somebody doesn't, if you're listening and you have no health insurance, and another group of people that, let's say you retired at 59 and you can't get Medicaid until you're 65 and you have no health insurance, that's another thing you can help people with.
Oh, yeah. And like I said, that ties in with what we were talking about with some of their financial planning and how they handle their retirement dollars.
All right, I'm Esther Gullius, the tax lady. We're doing taxes. We will help you with the 2019. We'll help you plan for 2020. You need health insurance. Tim Eliason is there with EG Health Connect. Until next week, I'm Esther Gullius, the tax lady, with Chris Fabian, Tim Eliason. We thank you for listening, and thank you for everything you do with us. God bless you. Bye-bye.